Okay.
I was just meeting with one of our commissioners who was going to be coming but couldn't make it today, so apologize for it. So welcome everyone to our monthly Community Advisory Council meeting in Shipley. Should we have any announcements before we start? If not, as we have done virtually every meeting, Rachel, if you'd like to start off by introducing yourself.
Rachel Kuchenstein, Rancher West Side.
Shrey Morgan, Lakeview Gardens, and Lake County Senior Center.
Larry Coulter, Lakeview Gardens.
Andrea Wishart, Senior Center.
Joni Moss, Senior Navigator at the Senior Center.
Nora Zimmerman, Regional Public Coordinator for Children and Families, and I work for Hobie.
Paul McGinnis, Greater Oregon Behavioral Health at the EOCCO.
Ginger Castos, South Central Oregon. I'm sorry, it's so long I can't even do it. South Central Oregon Economic Development District. Thanks.
Julie Keono, Lake County Chamber of Commerce.
Marty Provost, Chairman, Lake County Food Share, and Operation Manager for Lakeview Food Pantry.
Welcome.
And I'm Mira Norris, the Chip Coordinator.
Jimmy?
Jimmy Hall, Lake County Examiner.
So for those of you who don't remember who I am, I'm Charlie Twain. I'm here at the hospital. Thank you for everyone being here. We have a couple of items. Has anyone seen the minutes of the May meeting? Everyone's seen them? If you haven't?
I have them.
You haven't. Excellent, excellent. If you haven't, we have a copy here. Otherwise, I'll entertain a motion to approve the minutes. So, would anybody like to look at the minutes?
I approve.
You would?
I will make the motion.
Okay, we have a motion. Do we have a second to approve?
I second it.
Okay, it's been moved and seconded. All in favor, please signify by saying aye. Any opposed, same sign. Thank you. The next part we're going to have is Paul McGinnis, our CCO.
We have Mindy
Oh,
on
we
the
have,
phone too.
I'm sorry. Who do we have on the phone?
Mindy Panther.
Oh, welcome, Wendy. Sorry, I didn't mean to miss you. It came out a little bit loud. Could you just talk again so we can make sure we get the volume right?
I'm here.
Oh,
Okay.
great,
So Mindy Bentley from Advantage Dental is here.
great. Thank you. Sorry about that. Oh,
It's Stella Gomez, so Lake Shake, hello everyone.
Hi, Stella.
hi, Stella. Anybody else? Excellent. Thank you. Thank you, Paul, for reminding me of that.
You bet.
So I guess the next part is, Paul, to talk about the...
So I have just two EOCCO announcements. The first one, we were hoping that we'd be able to get this to you officially. The program actually started June 1, and it is called Cribs for Kids. We have purchased about 800, I think, cribs for folks. There are about 4,000 sudden infant deaths around the nation each year, and 90% of them are related to unsafe sleeping environments. So we had a few unfortunate deaths in Baker County, which kind of prompted the purchase of these kits. So these are for EOCCO plan members. You'll get a notice that when they go to their first trimester visit, they're eligible to receive this kit of material, and I'll shoot it around, but it includes a crib, a safe sleeping sack, educational materials, some pacifiers, DVD, that kind of stuff that the provider, once they come in for their visit. So if you remember on our incentive measures, one of them is timeliness of prenatal care. So this is one of the things that we're trying to do to increase that. So it'll come through Mira, we'll distribute it to all of the providers as well, but just wanted you to know that any EOCCO mom that's pregnant and is getting prenatal care is eligible for this kit. sorry that it's not official material, but it was supposed to start June 1. And it will, all the materials will be available in both English and Spanish.
Great.
Wow.
The second piece is some good news too. We are expecting, based on our own calculations, our own being the Eastern Oregon Coordinated Care Organization, and some results from the Consumer Assessment of Health Plans and Systems, which is a survey that goes out to the health plan members. We met one of the measures on the survey that we weren't necessarily sure we were going to meet, which will give us 13 of 17 measures, and we expect that the Oregon Health Authority will be verifying that that is the case by the end of this month. And that means that we get 100% of the withhold back. So I believe this year that's $10.6 million. Next year it's going to be even more. And so when we talked last meeting about how the incentive measure money funds some of the CAC activities, at the July and August board meeting, it's likely that the EOCCO board will decide how they're going to distribute that, but it's likely that you guys got about 28 grand last time, and so think that you're going to have more than that as we move forward. So not official word yet, but very good in terms of what we think our numbers are. And we made it by the skin of our teeth on a number of measures, and as I've said repeatedly, each year they hold back more money and the bar rises for performance. So we do need to keep working on adolescent well visits, the ages and stages questionnaire for developmental screens for kids 0 to 36 months. We did not meet the colorectal cancer screening, and we still have, I doubt we'll ever meet the measure on the CAP survey that asks about access to care, which says, I got to see my doctor today. I mean, you have to answer that always, or, you know, pretty much. And with the shortages that we have of clinicians in Eastern Oregon, it just doesn't seem to be a fair question that we're held accountable to, because we just don't, we could all use more clinicians, so we'll go from there. So those are my announcements. Look for a report next month on the cribs, and so you can get the word out to people that you work with, and then we'll know officially what's going to happen. But it's good news, and we didn't think we were going to get it. Some of the other coordinated care organizations may not meet their measures, and say you only got 80% of it back because you only met 12 of the 17 measures. The difference in that money from what they did get back goes into a pool and is actually redistributed to the CCOs that did need it. So
it could be more.
It could be more, yes. So good news for us.
We don't want to wish the other
yeah, no.
to,
But it could have been us giving them money too, so very good. That's all I have, Charlie.
Excellent. Thank you very much, Bob. And you think that we might know officially in July? Is that what you were saying?
Estella, when do you think the state's going to let us know about the measures? Sometime this month, we heard.
Yeah, I think maybe earlier than the end of the month of June, but I'm hoping.
Okay.
That's what I understand.
And when do we learn what our new measurement, our new targets are for the incentive measures for 2016?
Well, I heard mid-June, but I haven't seen any recent activity, but let me contact Sarah Barlow and see if there's been a change on the mid-June date. We're almost there next week.
Right.
Okay.
So, I mean, we've been working for 6 months on the 2016 measures, and we still don't know what our target is. So that's been common since the beginning of this in terms of timing. So, and when I talked about the withhold and us meeting the measures, that was for 2015, calendar year 2015.
So to recap, for us, that means that come January, when the transformation funds are available, we'll have more to work with to apply for programming. So keep in your mind, you know, what we want to do as projects, and I'll be presenting on the CHIP updated strategies, but we can correlate it with that, so.
Right, in the past, the EOCCO board has given money for incentive measures and also made available funds to compete for the transformation grant. So I don't anticipate that they're gonna do something different, so.
Excellent, thank you. Do you want to say anything about the upcoming regional community advisory council meeting? Oh, wait, sorry.
Yes, the Lake Community Advisory Council, you all are hosting the Regional Community Advisory Council meeting to be held in Burns, Oregon. I know that sounds kind of,
Well, nobody wants to come out here.
that's as far as we could get, so 10,
And that'll be next week, is that right?
it is, no, two
Mondays.
Mondays, the 27th. Anybody's welcome to attend that, but typically it'll be Charlie and Mira and Ken Kessner that attend that meeting.
We'll give you an update on how that goes.
At that meeting, we'll approve our overall regional community health improvement plan, just like you're going to do with Mira right now for the lake project.
Okay, great. Thank you very much, Paul.
You bet.
Mira, are you ready to,
Sure.
should I pass this out?
That would be great, thank you. So, I will be going over with you the updated strategy, CHIP strategy, that we determined via the data that we've presented over the past 2 months, as well as taking out the goals that we've already met and adding in any new goals that the group believes would be acceptable. So, everybody have one? Looks like it. Great. So I'm gonna go over it up on the screen for everyone to see. And I did notice that some of the folders, the first page is kind of slipping off. If that's the case for some of you, please let me know, I can reprint it. Let me know after. Before I begin also, I want to kind of state to the group that because we only needed data and not focus groups, that is why I have been encouraging us to implement the MAP strategy over the next 6 months, which we can come up with different strategies with that and seek out funding individually. So we will have an assessment coming out of that that is separate, but can also integrate goals with the CCO, if that makes sense for everybody. Because I think it's important that we get voices and not just data-driven strategies. So within the executive summary, the only update that changed from last report was that we added early childhood health. So that means that we'll be striving to improve the health of children ages 0 to 6 to give them a healthy start in life. And then under physical activity, we talked about correlating it with obesity and other chronic diseases. And if anyone has any questions or comments, just feel free, raise your hand and that's fine.
Food was going under there too, right?
Yeah, exactly, and you'll see that later. So our official mission statement, just to remind everybody, is to improve the overall health of county residents through focusing on the healthcare system, focusing on individual health habits, focus on the social and economic systems that impact community health. And here you will see our official 4 goals. Okay, so now we get into the nitty-gritty. So early childhood health, this was the new one. So this was brand new goals and strategies for our group to work to achieve. I met with public health. They agreed to continue to provide services for, public health is here. Didn't see you in. Great. So they will be leading the First Tooth program, which is servicing those children that are under kindergarten. And CHIP will be continuing to service K through 8, and we took out oral health as one of our strategies because we are working well within that program. So the goal with that is to provide fluoride varnish to 75% of preschool-aged children in early learning centers and to preschool-aged children, because some of them are not yet in learning centers, they might be at home still, so they would go into public health. Okay, the second objective is to gather a baseline on the number of children with developmental delays by partnerships with organizations servicing children. So this is important for us because we do have data on the state that 1 in 6 children have been diagnosed with developmental delays. But we don't know what is the state of our county specifically because there are lots of different entities that are gathering the data. We want to make sure that we have it all under one area, that we come together to look at that and therefore come up with some strategies that are effective. Any thoughts on that? I'm looking at you.
I like that.
Okay. Okay, so, and then the third objective under early childhood health is increased developmental screenings of children 0 to 36 months of age. That is reviewed with the patient by a physician by 37.3% by March of 2018. We came up with this very random number of 37.3 because that is the current objective of the CCO for us to reach in order for us to have reached our goal. Correct, Paul?
Yes.
That seems a
mean-
little bit low. The target is,
Well, it's gonna keep rising.
the target is 43 for the region. I'm talking about for the region, but I'm not sure.
Well, for 2015, it was 37.3%. Here, help me, we weren't in double digits here, were we?
No.
No, so we have a lot of improvement to do.
Absolutely.
You're in double digits now.
But if we increase by 37%, would that, is the way that's worded mean it would add on to what we're already doing and just increase what we're doing?
Oh, I see.
Is that what you
No.
meant by that? Or do you
No.
mean the total amount would be 37?
The
Okay.
total amount.
So you meant the total amount?
Yeah,
Yeah,
which I think is, you know,
so it could be just say 2.
2, okay, okay. Thank you.
And if this is for meeting, or kind of tied to the metric, it could also be reviewed with the nurse practitioner or a physician's assistant.
Right,
Yeah, so
Okay, so provider.
changing physician to clinician would work.
okay, thank you. Great. And so that was a really important strategy and objective for us because public health is already conducting screenings and they were not getting captured. So having the collaboration with our clinicians and public health will help us achieve that goal. They're already doing it. It's just about having that conversation with the clinician. And we have a grant that we are currently in the works for to make that happen virtually. So I'll be presenting on it if it actually comes through. I don't want to get everyone's hopes up in advance. The fourth objective is providing parenting classes and education for 70 community members by March of 2018. So those that are working within early childhood health and education know that we are one of the worst in the state for child abuse numbers. Public health and Head Start and other entities have taken the lead in providing classes called Parenting is a Pleasure. But we want to continue that initiative and educate parents on how to parent in a way that they have the skills to reduce abuse within families. So the strategy within that is that CHIP, ESD, daycare organizations in the school district would help to promote the program and also to make referrals.
Mayor, can I just add a comment about something that Charlie said last week, or last meeting? Your data does show high rates, but not all abuse is reported. So if you have a strong system of monitoring and maintenance and reporting, it's gonna look, I mean, you can't say it looks better, but I mean, it's probably more closely mirroring what's happening than in some of the other places where it is not reported. Those are reported cases that, have a review, not just calls that said, I saw somebody at the Safeway pull a kid up by the arm, which would initiate some things, but it doesn't mean that there was any neglect or abuse that was occurring. So,
Right, that's a really good point, and I think others might know better if Lake County has a strong system of reporting, and if the culture is like that here, because,
Well, are you thinking, for instance, if there is sexual abuse of an adult, there could possibly be abuse of a child at the same time, and maybe the person taking the call would be able to determine whether we can help the child too? Is that what you're thinking?
well, that's a good point, but my question is those of you that are from Lake County, been here a long time, know the system, do you believe that there is support and maybe a lack of stigma to make those kinds of reporting? Because what Paul is saying is that if we do have a strong system in place, our numbers are going to look higher. So that would indicate why we look so bad, really, compared to the rest of the state.
I think growing up here, when I was a kid, you knew of a lot of abuse going on and nobody said anything. There was definitely that atmosphere, of don't get involved, it's not, not your business. But I think now, more people are definitely more apt to report something like that.
I don't think the higher rates though are because we're reporting more than other counties. I bet you would see the same, I bet overall throughout the state, it's pretty equal. So I think our higher rates are indicative of higher rates. I mean, when you have a lot of poverty, you have a lot of child abuse, and when you have a drug abuse, you have child abuse. It's just, they go hand in hand. So I think that's very true. I would bet, just like in all counties, our rate is higher than what's being reported.
Well, I just wonder if I'm just sort of guessing, because I've been gone for a while and back for about a year and a half. But thinking about it, our small community, there's also sort of an intimidation factor. A lot of people are related to each other, and there's things going on, and it's hard to, kind of blow the whistle, and, there's social consequences. So I think that might be, I don't know, that's just sort of my observation.
Yeah, so it's not like we're reporting more than other counties.
No, I don't think so.
Yeah, thank you. See, that really helps, and that is an indicator why education is so important.
that could be something that might be explored in the map process. A little more detail on
So would,
community norming around reporting and
and
things
so
like that.
would that be a better strategy than parenting classes?
What would be?
To work with people more about reporting, appropriate reporting?
Community education.
I don't know.
We have community education, so that's the parenting classes, but also the last part is to provide access to resources for the abused. So this is kind of like, I guess, in the first step towards that. When we conduct the MAP process, I think that's a really good point that we should have a lot more clarity on how we want to go about approaching this. Really what this does for us is puts us, makes it us capable of relating it to the transformation funds, you know? So, to be honest, all right. And then, moving to our second priority is mental health. As I had presented our data, we have some of the highest suicide rates, alcohol-induced deaths in the state as well. So I kept some of the initiatives that CHIP had already worked towards within this priority, but we added one more. So the first one is by March of 2018 to increase the number of mental health providers. So we as a county would pursue greater access to mental health services, and Lake County Mental Health would lead on this initiative. One of the incentives that providers or people that are in the mental health field have coming out to a rural region is that there is a loan forgiveness program for those that are that have student loans. So they can come out here, work, and get that kind of taken care of. So this was something that had been in the CHIP prior. It had not been completed, so we hope that in the future it can be completed. The second one is by March of 2017, so that's next year, complete mental health first aid training for the police department, Lake County school staff, and congregation representative. So EOLA has a grant to provide first aid training for the police department and school district staff that are interested. And they would help lead on that and provide funding. And you know, that's important because those working in those fields will be able to identify the difference between a crime or, you know, being out of line at school and a mental health breakdown and what to do in those cases. We added in the congregation representatives actually after a conversation with Thule because I think it's really important that we continue to integrate individuals representing the congregation because they meet with individuals on a regular basis and they need also to know when it's over their head and what to do. So CHIP will help to lead on that, and Gobi has partnered in supporting that initiative. Any questions on that one? Okay. So then physical activity. Our goal would be to increase physical activity of Lake County residents by increasing the awareness of the healthy outback. This is also something that was previously in the CHIP and it had not been completed. So we hope to complete that by July of 2017. So Lake County has a lack of year-round low-cost physical activity programs. So we hope to provide partnerships, or presentation and workshops, and OSU Extension wants to do a Couch to 5K, and also providing with handouts and disseminating information on what is available within the county. The second objective is to promote and enhance existing trails and walking and biking routes in the county. So that is something that the Chamber of Commerce and Thule really was interested in leading, making kiosks and people that are walking out in the pathways to know that, you know, where to go and what's available. I'm not aware of them yet, so that would be helpful.
Julie, you've seen those tools on, that people can just go walk a route and kind of make marks about where things don't work right? Safe walking routes? Yeah, I mean, like
Like
there's,
the map my walk type of thing?
well, it's,
Location or-
no, there's like a nasty dog and no fence. Or this is not a safe place to cross the street. But I mean, that's a formal evaluation tool
Oh,
on
no.
neighborhoods. And I can
Okay, yeah.
get you the link for that, but I mean, you don't want to promote routes that,
Oh, right.
you know.
Mostly what we were looking at, Paul, was, you know, existing places for the walking that people are using now, like down near the baseball park and around by the, I always forget the PC way to say sewer ponds, but I hate to call it sewer ponds, but whatever it is. Around that region, and then getting back to Zeroptimus Park, which was already set up as a fitness center a number of years ago anyway. But we were also talking about working with Warner Creek to get 4x4 treated posts with mile markers on them.
Right.
So by the quarter mile or whatnot, so people would know and be able to assess their performance and then help them self-assess, time or how mileage, distance, that kind of a thing. But that's still a hugely important part of that, so we could put that in and
Yeah,
say,
we're
this has
doing
been identified.
some similar work in Lebanon as well, a few years back, and one of the things that they did that I thought was pretty good was they tried to make sure that they could link the routes to important public buildings, so wherever your
Right.
library is, and make sure that that's on your maps too, so that people,
Excellent.
if they're walking there, but I mean, just think about the public structures, I mean, really,
Yeah, go by the
getting
hospital, go by
people
the
to
schools.
walk less than a mile is the key, really. It's not necessarily to walk for exercise, but it's to not get in their
Oh, yeah.
car and just
Park 2
walk.
blocks away.
And walk that little distance, so, that would make it, I'll make sure to get that to you.
Okay, great, appreciate that.
Great. Okay, and then our next objective is to create a physical recreational activity, and have 50 youth participate in this. This was again something that came out of the previous CHIP. It would be targeting K through 6 and particularly in the winter months. So that's something to develop and work through, and CHIP would be leading that. All right, and then the next objective is to create.
Oh, I hate to be a pain, but,
What?
on the winter one, I missed that when we were reviewing it. When I read that before, I thought this was the woman from Cooperative Extension that did the triathlon thing.
Jamie Davis.
Yeah, and that's what I actually thought this was. So, but that happens in the summer, so these aren't kids doing this, right, for this one? Okay.
Yeah, that's separate. So she's involved with, she wants to do the Couch to 5K. That would be her part in the physical activity
Okay.
program.
Thank you.
So then the next one after that is create a physical recreational education program targeting preschool aged children. We would be working with Affordable Fitness. They're the new gym out here, and she wants to provide mommy and me or parent and me classes for children that are preschool age. So the target for that would be to have 15 parents and children participate by March of 2015. And then the last one is related to Emmy's food security assessment. So she will be completing that assessment at the end of this month. And what comes out of that can really be an indicator and a help to reduce obesity and other chronic illnesses that we have become more and more aware of and seen an increase in our numbers in the county. So the first strategy would be for Emmy to present within service organizations and what are her findings, and also for CHIP, our group, to support what comes out of that. And it's looking like, it's going towards having a community greenhouse, but we will let her present on that and her findings. Okay, then the last one is senior health. So the goal is to increase senior health and well-being because we do have an aging population. As you know, 54% of the population is above the age of 45, and 23.4% are above the age of 65. So 23.4, and it's actually in here. You'll see it in the back.
Okay.
So the goal would be we've challenged the senior center because of the success that we've seen with Noni, the navigator position. Initially, the goal was 100 seniors for the navigator to reach, and you were able to make contact with almost 650, right?
And it's actually over 7 now.
That's great. So calculating the amount of seniors within our community, we feel that it is doable to reach 700 seniors, to provide transportation services, nutrition programs and all the different links that the senior centers is connecting seniors to.
It's pretty amazing
Yeah.
how great the senior center has changed dramatically. For those of you that have been here for a while, to know how impressive that is, that's really awesome. That's a great job. It's evident, and I'm sure it's having a huge difference, not just on the health, but on attitude and perspective, a lot of our senior population.
Well, and one of the programs that Jamie Davis initiated was the Strong Women Program, which she adapted to Strong People Program because there were men who wanted to participate.
Thank God for that.
And yeah, and actually it's a great, the exercise is very low impact, it's very inclusive, it's not, specific for females, it was just targeted by the OSU extension to increase female activity. So we do have males that wanted to participate, but one thing she said to me was, or one of the instructors said to me was, we don't really need to advertise for this program anymore. It's, the next one was getting ready to start, hadn't even started yet, and they already had people signing up and, already calling and saying, where's the paperwork and how do I get involved? And they don't need to advertise for it. It's people coming to us saying, where is it, and when is it, and how often, and so.
That is great.
It's a great program, and there's a lot of, it's even expanded, it expanded into Paisley and North Lake without us even trying. It just, we want that, we want to do that. Why can't we do it? So.
How did it expand? By word of mouth, Paisley?
Yes. Yes. When they put it out and they announced it, there was, I think she said there was 3 or 4 people from Paisley that wanted to come down and do the training to be instructors. And then, of course, they talked, and then people in North Lake County, Christmas Valley, and Silver Lake heard it and said, well, we want to do it too. So we already have instructors certified up there, ready to go.
So if we have roughly 8,200 people in Lake County, 23.4% are over the age of 65. That's almost 2,000 people. So if we if we could achieve 700 people, that's not quite a third. That's a huge, huge benefit to our community.
Well, that's why I was wondering, because West Side, they're kind of another group, and I can see a lot of those, they don't want to come into meetings, they're just not, I don't know, they don't socialize there, but they socialize out there, and I was thinking, well, if we had, I wonder if people would come if we had a program out
Someone has
there.
already asked about,
Who did?
someone has actually already
Oh.
asked about possibly doing one at the Grange out there.
Yeah,
At the
so
Grange?
Grange is probably available.
That would be,
That, I think we could get a super amount of people.
that would be an awesome thing. So,
Maybe not charge quite so much, or is that what it costs to hire?
That's it's a set cost for the equipment and all of that.
what is the cost per person?
It's $50 initially to set up, and that covers the cost of getting the weights and the equipment and everything to do it. And then, I think once you've been a member, it's $25, is that right?
Per month or?
For this session, and
Per
it's.
person.
Yeah, per person.
That's okay.
Yeah, it's a 12-week, 12 rates. Let me say that right. I think it's 12. They've literally run back to back to back right now, so I think this is the 4th one. At least the 4th one in a row that they've done. And, but once you pay the initial $50, that buys the equipment. And then if you continue, it's $25 for the next 12-week session. And it's twice a week.
That beats it and refit.
It does. That's awesome.
Well, along those lines, after speaking with Andrea and Noni, they had recommended that we also incorporate a local dance teacher to provide low-impact senior dance class, which at the end, they could do, you know, maybe a large event at the senior center, like a ballroom dancing, or however they want it to be. So that now is officially within our CHIP. And particularly in the winter months, I think that would be really successful to get seniors out moving.
I mean,
And
like, so you think you can dance competition?
That would be so much fun. I would love to be on the panel for that. Okay. The last strategy, which was added for senior health, is an oral health ban. Seniors often do not have access, or they do have access, but it's still expensive for them for oral health care. And I have heard that many, many times going out in the field with Advantage Dental, especially like up in Christmas Valley and here as well at the senior center, we did a presentation, and that was the feedback we got was, we can't afford it, and it's not in our insurance, it's not covered. CHIP would arrange for a dental van to increase visits up to North Lake, because North Lake currently does have a dental van that goes up there a few times per year, but they need that to be increased, and Lakeview to also have that capability, to have that service here. So, and CHIP would look for funding and local donations as well for that. So those are the different strategies, and after that, it just breaks it down by metric and timeline for each one that I just covered. So it's there for you. And then the last part of the strategy just goes over our target population, you know, the changes within our Hispanic community, as we've been talking about the last few meetings, and just a little bit more about how CHIP was established 3 years ago, and our partners. And that's pretty much it. And risk management. So in terms of, you know, keeping up our CHIP and keeping up this group, you know, we do have to continue to be invested as a group. It's not just, you know, one entity. We are a collaboration, and that's what makes this successful. So in order to reduce our risk, we would continue to be invested as a group and share resources. So that is it. Any
Thank you
questions?
for putting that together.
You're welcome.
So I have a question if Mindy's still on the phone. Mindy, you still there?
Mindy, are you there?
Hey, Mindy.
Can you hear me?
Yes, Mindy. Mary Ann Wren organized something in Baker County for seniors that involved dentures. As much as we want people to keep their own teeth, there's still some problems with nutrition because of not having the right fit and stuff. Do you know what she might have done to do that?
Repeat that last part, Tom, do you know what's what?
Did you know what Mary Ann offered to the seniors that were non-medicated people around denture repairs and fittings?
No, and I'm actually very curious to find out, because if they can offer it there, I would love to be able to offer something at least similar in this county, so I will definitely talk to Mary Ann on that.
Yeah, it may have involved students somehow, but, I mean, I'm not sure dental hygienist students learn about dentures, do they?
Well, you get to a point.
So, yeah, if you could check in on that, might be something too on that. I mean, besides traveling for dental services, with a large portion of folks just don't have.
So that's not, you know, we'll learn something about the ask you guys, and let you know if it's something we can do, and so what it entails.
Yeah, I'll check with Mary Ann too, and then let people know.
Great.
Okay, great.
Are there any other questions or comments? Okay.
If that's the case, then I would suggest that we vote to adopt this revision, these revisions to our 2016 to 2019 health improvement strategy plan, strategic plan. Do we have any, anyone want to make a motion?
So moved.
Okay, it's been moved. How about a second?
Second.
Perfect. It's been moved and second to approve the revised community health improvement strategic plan. All in favor, please signify by saying aye.
Aye.
Any opposed, same sign? Thank you.
Great.
Good job, Eric.
Yeah.
The next thing we have is the EOLA update.
Sure. Not a lot to update the group on. So we meet every month, EOLA's Board of Directors. EOLA is continuing to focus on 4 programs right now. One is the school-based oral health program. They are currently in the interviewing process for their coordinator for that. And we hope that they find someone great. And after that, they will be implementing what Lake County has had into other counties throughout Eastern Oregon. So that's exciting, and they will be providing K through 8 similar to what we are providing here in those different counties. The other program is mental health first aid, as I discussed within our strategy, providing it to police officers, the police departments, and to school district staff. And they received a OHA grant for $30,000 for that.
So that money technically is to support the teacher's time away from the classroom. If they, ideally, we'd like to do it on an in-service day, when they're there in the school district and the superintendent say, yes, this is important for our teachers, this is the in-service. If we have to do it on a regular day, then it would be to pay substitute teachers. If law enforcement says, yeah, we'd love to do it, but I can't have my patrol officers sitting in a room when we need people out on the streets, the resources go to support, a substitute police officer to take their place so that they can go through the training.
How long is the training?
8 hours.
Oh, it
Yes, and this is a nationally recognized effort through the National Council. They're trying to have over 1 million people going through the mental health first aid. And it's now available for veterans, seniors, children, and law enforcement. So there's 4 different models.
I like the idea of the veterans. We went up to Christmas Valley with our OBGYN a few weeks ago, and a lot of the folks up there were talking about PTSD as a significant issue for a lot of the veterans up in Christmas Valley, and to have support for that. A lot of the people that had been in combat, they don't want to, even acknowledge that there's I'm fine. But their wives are coming and saying, no, you're not. I know you're not. And so having that out there, that might be something to pursue in the future. Yeah, great. And then the third program that EOLA is working on is colon cancer screening focus groups, which I think now is almost completed. Is that correct?
We've done all 5 of the focus groups. Transcription of the services is happening right now, and then we'll have a report to share back with you probably within 2 months.
Excellent. And then their 4th program is the Early Childhood Health Program, where they would like to create a nurse home visiting program that integrates a mental health aspect, where it would be a soft handoff to a mental health provider. So the nurse would go into the home, assess the mother, whether or not she's experiencing some depression, and then would link her with a mental health provider. And I think that it's a really good idea, and I talked to John about having it here, but I don't think currently, and maybe, give me your insight too, we have enough mental health providers at this time to do a program like that here. So, but that's what they're working on, and maybe in the future, as we do increase our mental health providers, we could do something like that. So that's the EOLA update.
It's pretty unique. The only screening service that the U.S. Preventive Services Task Force says that you shouldn't conduct if you don't have a place to refer is depression screening. They actually say, don't screen for depression in primary care if you can't refer them somewhere. It's very strange that that's the only one that does that. So it does seem that that's probably a wise statement. Right, you said if you're going to go in with a bomb and assess for postpartum depression, and if you don't have a resource to get them to,
You've exacerbated the problem?
yeah, probably. But I would hate, I would hope that we'd have a little room for somebody, with that particular type of depression, postpartum depression, versus general population depression, which is what the recommendation from the U.S. Preventive Services Task Force is about.
Okay. Well, good. Thank you any questions about Eastern Oregon Healthy Living Alliance?
When we wrap up that colon cancer grant, we're going to go after another one from the Knight Center. We'll let you guys know what's going on there, see if we can't use some of the findings from the focus groups to target some other efforts.
We've got to find another way of talking about it.
We talked about that last meeting, framing it.
Because that is such a hard thing difficult thing for people to talk about.
And it will,
it's such an important.
And that will come out of the results of the focus group, that hesitancy to discuss, which will lead us to be able to say, hey, look what we learned, and here we go.
Stella, do you want to give us an update on what's going on with the Oregon Health Authority? You're still there? Stella?
Yes, I'm still here. I just wanted to answer Paul's question regarding when we will receive the 2016 measure performance. That's going to be on June 23rd. As far as training right now, I'm not aware. Hopefully some of you have been participating in the colorectal cancer adolescent welfare visits. And if you're able to participate in the webinars, they have been recorded, which might encourage and receive information regarding how to get adolescents and parents involved with ensuring that their adolescents get their wellness checked. So if you miss the webinars, they are up on the OHA transformation website.
Good to know. Good to know. Any other changes that we should be aware of or things we should be thinking about from the OHA standpoint, Estelle?
Well, I think, like Paul mentioned, the benchmark, they're going to include what the percentage is for the measures, and then they're going to add the tobacco, it has to do with the reduction of tobacco use, and also ensuring that the discussion with the medical providers regarding someone wants not to get pregnant, that there is that discussion going on between the patient and the medical providers. So those are the new ones that I think are coming up that I'm aware of.
Good.
So there's more tracking, more data collection, and we continue to have new discussion for the 2017 benchmark.
And Estella, the actual waiver process that the state is using with federal government to update the plan, any comments there other than they're going to emphasize housing within that?
Yes, there will, because the thought is, if a person doesn't have adequate housing, it affects their health care. And so we want to be sure that housing is also taken care of to assist the OHP members and all of our community members to ensure they have a safe place. So yes, that is coming up as far as housing, and also perhaps that's in a final discussion regarding do individuals have enough food in their home, or are the resources available in the community, because lack of food, lack of housing, there's so many things that belong to that a part of the family, part of the child's world that will affect future health outcomes. And the reason they're really pushing out of the home care business is because if they get hooked up with preventive care services and understand that they can take care of themselves with the right guidance and direction, they will have a relationship with the medical provider. And which is good, because if we get health concerns resolved and individuals, if we can help them with taking care of themselves, hopefully they'll have fewer health problems. And also adverse childhood experiences, they're talking about trauma, how trauma, when a child experiences that affects an adult, and it also affects them getting chronic diseases if they are exposed to trauma. So there's also another interest in getting providers, anyone that works with the family, works with the child, to understand how trauma affects the person. Because if we can reduce trauma, I think we will have fewer chronic diseases, and people will live longer and people will live healthier.
So just for background now, right, this program, Coordinated Care Organizations, and the OHP program is a partnership between the state of Oregon and the federal government. Oregon said we want to do differently how we run our Medicaid program here in Oregon. Therefore, we're submitting this waiver to get you be different from the rules, waive the rules and say, here's how we're going to do this. And it's up for renewal. And these things that we've talked about around this table for the last 3 years that really had no funding in terms of direction, the food security, the early adverse childhood events and trauma, housing, those sorts of things have been built into this waiver. I don't know how the money will flow, but if it's accepted by the feds, it means that some of the resources that OHP members have can be used to fund some of those activities. Which is, we're going upstream here.
When we're talking about health modernization, they are talking, how are the CCOs working with our public health department? Because the health departments work with many community members regarding health concerns. So I think there's going to be a real push for CCOs to work with the local health department.
Thank you.
And I know that Colton hired Nora Zimmerman, and she's working, she was really getting her team under her, but she's working with public health department directors. So in the future, I foresee the public health directors of the various counties coming together to discuss how we can work together collaboratively.
Excellent. Well, Nora, now that since you're here, maybe you could talk a little bit about that. We have a little bit of time. Put you on the spot.
Well, originally I was hired as the Regional Public Health Coordinator for Children and Families. So my focus is children and families, but I can see my role expanding as I am working with public health directors. This morning I met with Beth in all of the 12 counties. So I'm really excited for that opportunity. I think it makes sense. I'm already there, so might as well talk about some other things as well. And so what exactly would you like me to talk about? My mind is always ASQs for right now. I've got this grant. And that's the main reason why I've come to Lakeview, I'm working with John Adams with the Eastern Oregon Healthy Living Alliance, and we're creating a proposal around the maternal, it's called an integrated home visiting and mental health service. And basically what it is and you take an existing home visiting program like Cocoon or Babies First, and then you integrate mental health. And so you bring, like, just like Mira described, the provider would come to the home, or possibly via telemedicine, and kind of start working with the mother, just to kind of get her comfortable if she's having issues with depression and those kind of things. And then once she's met with the mental health provider, transitioning into a more traditional appointment, approach, a more traditional approach. So I've come here to work with John on that. I'm also really excited to work with Mira on the tablet project that I don't know what the official name is, but so I'm working with her on that. So really my role is to support the communities around children and families, but like I said, I can see the role expanding. Paul, am I right?
Yes.
So I'm really excited that you guys have chosen children's health as a priority area. It's really important when we can identify delays. It's not the end of the world, they just need some extra help, and if they can get that support, the earlier the better. And so going forward into school, if you think about it, you have a child who has a developmental delay at say like 16 months. It's a lot easier to work with that child at 16 months rather than waiting until he's in kindergarten or first grade and he's dealing with these issues in the school with the teachers where they're not as equipped. They don't have the time that they have when the kid is not in school, if that makes sense. So as far as developmental screening goes, as you guys know, that's one of your incentive metrics. I think Mira's right on track with her goal. I'd like to see the percent increase more than 37.5. I think you guys can do it. I know that screenings are happening, but they're just not being captured, and that's another area that I'll be working with Beth and some of the primary care providers here on that. And also possibly making some changes through MODA and things like that to make sure that those are captured.
How does that go about? How does that conversation happen?
I told Paul, and he's gonna.
Is it really just like that?
Well, actually,
No.
I did follow up on your question about billing, and I haven't gotten an answer yet. So I did write that, but the other piece is, okay, we already have contracts with public health. You have a clinician supervisor. Somebody is the public health director, correct?
A health officer?
Yeah, and so that would be MD, correct?
Yes.
Okay, so you have somebody that the nurses are working under their license, doing those activities, correct?
Standing orders?
Yeah, so why can't public health build the right code to EOCCO? I don't know. I'm gonna look into it. I think the system is set up to allow for the, I think Nora said you guys do about 10 to 20 screens a year or something like that.
No, families. They're working with 10, 20 families.
Oh, okay. Whatever the number is, I mean, you should be paid if something may be causing a little ripple there, but,
Right.
If you're already a contractor provider, why can't you do it?
Yeah.
So I'll check into that when I get back and see if we can make it work. When you think about it though, you got about 70 births a year, so that's 210 kids that need screened every year. As long as we keep having 70 in, well, 70 leave. So, I mean, that to me, that's very doable. That's a real number that is doable in terms of the ages and stages questionnaire.
Does that need to be done through a home health agency rather than directly through home health?
No, it actually.
In terms of billing.
That's what I'll have to check into to figure out what's going on.
I don't know the answer.
I mean, if it happened in the clinician's office, there's no problem.
It doesn't actually have to occur in the physician's office. So for instance, you could, Jill Harlan could go out and do a screen, and she could, just as a total hypothetical, this is not what's going on now, but she could, although she has in the past, send the results to the primary care doctor, And then the child would go in and the results would be reviewed by the doctor with the family, and then it would be documented in the electronic medical record. So that's the piece that's kind of like, you know, Jill, here's Jill, and she's a nurse, registered nurse, she's got years of experience. It's not counting towards the metric at this time, so that's the ripple that Paul's gonna look into.
No,
If that were the case, I think that would solve a lot of problems public health could build. It makes sense, I see this all over this region, so.
How is it being done in other communities outside of Eastern Oregon?
Outside of Eastern Oregon, I'm focusing on Eastern Oregon right now. I just started in February and I'm just.
Estella might be able to address this from the other CCOs, but I think statewide it's been
An issue?
an issue, yes. We have a lot of
Yes.
early childhood organizations, the ESDs, that are screening these kids, but it's not
Being tracked.
It's not being tracked.
There's a lot of duplication, and I don't know what they're doing in other areas, but I know what they're doing in other areas within Eastern Oregon. And it's, you know, they're working, like in Baker County, because I'm from Baker City. In Baker County, the home visiting team they have a good relationship with their primary care providers, so they have a referral system set up, so when they first meet with the family, basically what they do, they have them sign a sheet release, you know, allowing them to release information to primary care. So whenever the screening is conducted, they fax it over and then they'll call and schedule an appointment. So that simple.
But that's not tracking the home visit.
No.
What that's doing is it's calling for referral. That's the difference, is you want to get to where you can track that home visit, which is so important.
Right, because I think a lot of times what could happen is that if these families are the most vulnerable, they're not the ones that are gonna go in that second step to go into the provider. If you knock it out all at once and that's capable,
Right, yeah.
that would be the easiest way to go about it. And that's kind of what we intend to do if we receive the grant via telemedicine, or to simply just have it billed directly and having the nurse be allowed to bill that, but it's not there yet.
But they are getting referrals. People that have problems show up in their ASQ are getting referrals without the physician reviewing it.
Right.
They are.
Oh, yeah, absolutely. She's referring them to ESD or whatever service is appropriate for the LAC.
For that early intervention.
Oh, yeah.
Yeah.
Mhm. Yeah, they go to Mike Benson or wherever, whatever service that it indicates they need. Either Mike Benson at the ESD or whatever other services indicated. And then she was sending the faxing all the ASQs to the physician, and they didn't want them because they were getting all this paperwork. If they were normal, they didn't want them. So then she went to just faxing the abnormal results. And, but she was still arranging the follow-up, not the physician typically. It was just to notify the physician that was happening.
But again, that's information, excuse me. Sorry, Estelle.
Oh, hey, this is Stella, I wanted to say hi, Dora, I didn't know you were there.
Hey, Stella.
You said nice things about it.
They want to make sure that on the Eastern Oregon CCO website, notice relevant items about regarding billing, coding, because that's what we sometimes I think get lost. It's not coded correctly, there it's not billed correctly, and then we don't get the what they call, we don't get credit for it. And so, but I know that North doing an awesome job. They're working with our local communities with ASQ.
Well, and I think that what I've seen is there's not really a cookie cutter approach that's gonna work for every community. You know, what they're doing in Baker County is not necessarily gonna work in Lake or Wallowa or any of the other counties. So I think that I really like Mira's idea. It makes sense for your area, how it seems a little remote out here.
A little is understatement. So, any other questions or issues we should talk about on this before we go to our last item, which is name change? Oh, sorry.
We have a talking, can we talk about nutrition and food?
Absolutely.
I'm the food guy. Through the Oregon Food Bank, they started a new, well, it's not, it's about 3 years old, but it's new to Lake County, addressing the nutrition issues. And now for the next 4 months, we have the availability to bring in better than 150,000 pounds of fresh #1 fruits and vegetables
How is that being accomplished?
by semi-truck. We did our pilot last Friday. We did our first practice run. We brought in 2,200 pounds. Jimmy ran one little ad in the paper, and we distributed 2,200 pounds in 43 minutes. We were mobbed. The people were climbing over the side of our trailer.
Wow.
We had a very, very hard time tracking due to trying to keep people out of the boxes.
And it's all fresh vegetables?
All fresh.
That's incredible.
#1 fresh, that's pre-Safeway,
Okay, pretty safely, and it's coming from Klamath?
coming from all over the place.
All over
But
the
it's
place?
being distributed out of Portland.
Oh, out of Portland.
It's coming from Portland to Klamath and then from Klamath to here.
Is it coming just to Lakeview?
No, it's for Southern Oregon.
Okay, and in Lake County, is it going anywhere else besides Lakeview?
No. No. Right now, just to here, strictly because of logistics. The quantity and the amount of transportation and the heat, and, being able to keep it fresh. Klamath is working on a refrigerated tractor trailer so that we can get more distribution spots. But right now, we're the only, in this part of, we're the only ones in Lake County that have this available to us. And we have available about 10,000 pounds a week.
Wow.
There's no socioeconomic ties to it. In other words, you don't have to have a food card, you don't have to have any kind of card, no documentation, anything. The only thing we have to do is track numbers. And their goal in this program is to get fresh fruits and vegetables to the plates in the home. And so they don't care, if it's the judge, if it's the council member, if it's the street person, they want the fresh fruits and vegetables in the hands of the community. And so we just started, we have available transporting and distributing takes a lot of time. Our 2 food programs we have going on right now is running us somewhere around 150 to 200 hours a month, volunteer hours, and, distributing and storage and so on and so forth. So we really want to try to get the word out. We can definitely use help in this program. But it runs through October the 15th. And it's right now with monies that we have, we're just able to do 2 times a month, and we're just looking for donations and whatever helps so that we can increase it and do this every week.
Why is it stopping in October? Because here it's actually the winter months that really fresh vegetables.
It's fresh out of the fields.
Oh, fresh.
Fresh. And it's not, it's not the same product every week. It's what, the excess of whatever the farms have. And, maybe this time we had cabbage, Walla Walla onions, yams.
Tomatoes.
Roman tomatoes, had lots of tomatoes, and baby red potatoes. So it's a super deal. And the only thing limiting us is the ability to get it here and the people to give it to. And their focus is numbers, of course. If you give away 2,000 this week, can you give 4,000 next week? Can you give 8,000 the week after? And they gave it for our target at 10,000 pounds a week. It's a lot of produce, a lot of food. It's awesome. There's no reason.
Is it mostly vegetables? Because you've been describing vegetables, not fruit.
Right. So far, the fruit has not come into season yet. Obviously, a lot of the vegetables and stuff now they're getting from, Southern California. Maybe some of it's coming up from Mexico. We're just now starting to see watermelon and cantaloupe and so on and so forth. But I'm sure that what we're getting is the overage, from the farm.
Right.
And so, the real picking season hasn't even started yet. And so we're just getting, It'll be from wherever they're getting it from, and that hasn't been disclosed to us.
Marty, in this program, if somebody could donate like a reefer van, or they could commit to using their truck and trailer 1 week a month, can they get a tax write-off for that? Is that available for a company?
I don't see why there wouldn't be, because it is a donatable, trackable commodity. Transportation is trackable, for sure.
If we wanted to increase that volume, I'll bet you we could accommodate some of our seniors that often are on very limited budgets.
Yeah, that's what, you know, what they're trying, what we're attempting to, and we started in the paper, our focus is for seniors and young parents. You know, primarily, we deal with a lot of single moms, which they are the most economically needy.
Right.
You know, we don't want to put anybody out. I mean, it's not focused, we're not focusing on need, we're focusing on health. This is a health-driven program. And so, I mean, you deserve as much as the guy in the street to eat healthy. There's no, you know, there's no discrimination between in health. And that's what they're trying to supersede is, you know, people can't afford a lot of fresh fruits and vegetables. I mean, again, you know, they are a little stingy. And so that's what this program is doing, is just trying to break that wall down and make it kind of an equal playing field.
Is there any plan to maybe 1 time a month go to Paisley or North Lake with them?
We will supply Paisley on a weekly basis.
Oh,
I gave them, I think, around 700 pounds went to Paisley. And we do supply Paisley through the Food Alliance. And then they do get a percentage, or they do pick up at the food bank in Klamath on a monthly basis. So Paisley's taken care of well.
Don't we have transportation that goes up to Christmas Valley for some of the patients?
Not on a regular basis, it's on an as needed.
As needed. Because that could be a collaboration if there was something regular going where you would send it up with them. What day a week does this happen?
Fridays.
On Fridays.
Right now it's every other Friday. Next Friday would be last Friday was our first one, and so next Friday would be the next.
Mm-hmm.
And we would really love to get it to be, you know, to do every Friday.
Mm-hmm.
And if there was somebody that we knew in Christmas Valley that could come down with the truck and trailer and meet us, you know, and we just collaborate it and get wage and poundage for them.
Yes, thank you for sharing.
It's all good.
There is a church that provides a food bank in Christmas Valley. I don't know which one it is, Christmas Valley or Fort Rock. I don't know.
I believe it's
I'm sure
the
that one
community
needs to
church
find out.
of Christmas Valley.
Christmas
It's
Valley
fine.
I
Community.
believe it's the community church of Christmas
Yeah,
Valley.
they may be willing to come down. I don't know.
The opportunity is awesome.
Mm-hmm.
Awesome.
Absolutely.
The price is definitely right.
and did you say it's this Friday is the next one?
I'm sorry?
Tomorrow is the next one? or
No,
the
next
week?
Friday.
Okay, and then what time?
About 1 o'clock.
Okay. So can we like let our WIC moms know, or?
You can let everybody know.
Okay.
And we just pulled the truck and trailer up along the curb at the gathering place, and they just mobbed us.
I saw that. I saw it. I didn't know what was going on. It was pretty crazy.
What time did you say again?
About 1 o'clock.
1 o'clock. I'll put it on our CHIP Facebook. I sent that link out to all of you. You know, that's the kind of thing where we can promote resources available, and it seems like particularly in Lakeview, they use Facebook as a way
Oh,
of
it's-
trade and selling, and it's pretty incredible. So we'll put that on our CHIP too.
Cool.
Yeah.
That may be the problem, for you may have many more people.
Yeah, well, it's a wonderful problem to have.
It is.
Well, thank you for sharing that.
You bet.
Do you have a, at the site, I wonder if it would be good to have something where people can donate if they're able to? I mean,
They don't want any donations from individuals.
okay.
We can accept donations from a group or an entity to cover the transportation costs
Right.
only. They want no money involved for the product. So we have to be real careful in solicitation in that. You know, if it, under a church entity or a, you know, an LLC or anything like that, it's fine. But an individual putting $5 in a hat, we don't.
They don't want that.
They don't
So you're saying that we could be doing this weekly if we had transportation?
That's all we're looking for right now, is just covering, and we'll get it. I mean,
Do you
last
know
week
what
was our
the
first
cost
time.
is?
So it
What,
runs about $75.
about $75 a week
Mhm.
to get,
Yeah, that covers the gas and a sandwich, and a soda pop.
because I'm wondering about like some of the service clubs, like Sir Optimus, or if they would be willing to donate some money to go to this.
Yeah, I mean, to invest in the community is just a small amount of money for what we get. I mean, it's just pennies on the pound. There's very, very few things you can do that would impact the community for your dollar, that you would get better impact than this.
So it's what, like 90 miles from here to K Falls, right?
Yeah, I'd say 100, it's a 200-mile round.
Okay, 200-mile round trip, then, I mean, that cost goes to who?
That gas goes into my pickup, and I get a hamburger and fries and a soda pop.
So you're bringing it over.
Yes,
You're
sir.
doing it, yeah.
Yeah.
I thought
I
you
think
said
it has to
tractor
transport.
trailer.
My truck and my trailer.
Oh, okay,
Klamath Falls is trying to purchase a big rig,
a refrigerated.
refrigerated,
Okay.
because
Because I was gonna say, that, I mean, you can't.
then they'll start targeting
At regular
Christmas Valley.
at regular federal mileage, it's 54 cents a mile. So I mean, that's, you know, over $100 right there, so.
That's my cost.
And then if it's volunteer, that's different time, but I would, you know, I think the Sir Optimus Association would think reasonable. 75 cents is too cheap to go to. K
Well,
Falls.
that's real life, that's
Right.
real life cost. I mean, not wear and tear, but I mean,
Right.
that's what it costs to go in the gas
But
tank.
it is wear and tear. You
Yeah.
gotta replace that kind of stuff.
That's God's problem.
All right.
We don't sweat the small stuff.
That is so excellent, thank you for sharing that. And as you saw, part of our objectives is food, so
Right.
we will continue to talk about this.
There's lots of exciting programs, and so we're throwing our hat. It's amazing what's available if you ask for it. And the biggest thing is just being able, because of our location, it makes us, we're able to get a lot of things that people in the cities can't. But we just have to be able to go get it and then immediately disperse it. They don't want store time, they don't want it going into a cold locker, they don't want it going to a restaurant to be recooked and served that way. They want it fresh on the tables. And their original thing to us is they don't want to take it off. They don't want us to unload the trailer. They want to give them away on the trailer to where at the end of the day or when we're through, it's done. They don't want to take it inside and store it. They want that fresh food in the people's hands the same day.
Is it always gonna be the gathering place?
Or wherever we find some shade trees.
Because if we're telling people, they're gonna wanna know where to go.
Yeah.
And there may be parking issues or.
Yeah, we parked right on the curb in front of Mario's in the gathering place, and it jammed up traffic real bad, so.
Yeah, it did. That was one of the reasons why I noticed it, because somebody stepped out into the road just as I was going by.
People were crazy. I mean, there's 4 or 5 people
I
standing in
know.
the middle of the street and go to walk across and turn around and come back. It was
Yeah,
dangerous.
Maybe
what
something.
about the city parking lot?
That would probably be a very, very good place.
Yeah.
Or down by on Center Street, by one of the churches.
Well, that's where we were. It was on the corner of Center and
F.
was it F? That's where the
We
gathering
were
place
on
is.
F Street.
Oh, I'm sorry, I was thinking.
So how will people know? Is it gonna be in the paper every time, where it's gonna be at, or?
For the first couple times, yes, with Jimmy's help, we'll try to put it in the paper and stuff. But in a small town like this, it don't take but a week or two and everybody will know, you know, and then we post it. The social media is by far next to the newspaper is bang up job on that.
So you guys are keeping track of numbers, just?
Yes, we track, that
So-
is a,
Can that information be used, Mira, towards this, capturing that information for the
we
food?
did, let's see, that'd be 2,200. So we did 1,500 pounds
Like how many families?
to 67 people, servicing 272 people.
That's great, yeah. So that can go into Emmy's, I mean, Emmy was there.
Yeah, Amy
right?
was helping.
So, yeah,
Or she works, anytime we're open, she's there.
yeah, good. Well, thank you very much.
I have a question. Bernie trained me in bag wrapping
Mm-hmm.
And so I have a bunch. Where do you want them then? Do you want them?
We can always use them, you're talking about like Safeway bags?
Yeah.
Yeah, only about 1 in 4 is good, the bottoms rip out of them after a little bit, but
okay.
we'll take,
They're double, you know.
either, if you double them like Bernie does it,
Yeah.
you can either just put them on the door at the warehouse,
Oh,
or if you go through the alley behind the gathering place, there's the back door, you can set them by the back door if nobody's around.
okay.
And we will definitely use them, because we went through a bunch.
It's excellent news. We will be excited to hear about it as it goes along. I know it's 4:30 and that's the time the clock is not accurate, sorry. Our last item of business is the official group name. Remember how we asked everybody to think about, do we want to change the name at all? Right now it's the CHIP program, but we get CHIP and CAC, Community Advisory Council. Anybody have any opinions or feelings?
I think CHIP's easy to remember.
It is,
Where'd the healthy outback thing go?
out the window. No, I don't know where it went. Really, it's a great idea, healthy outback. But does anybody have an opinion about healthy outback?
I think CHIP is short and sweet. If I say I'm going to CHIP meeting, everybody knows what you're talking about.
Okay.
Healthy Outback was a branding for the physical activity stuff though, correct? Under the
I was trying to
plan.
remember, yeah, you're right.
It was about, I mean, it's been focusing on bicycling,
You're right.
on walking, exercise.
That is the branding for the physical activity. Okay, good.
And the food group is under the Healthy Outback as well, that Emmy leads every month. Yeah.
Yeah, well, I don't know, I question changing because, I mean, chips aren't healthy, but we're healthy, and if you remember what the acronym is, it's well stated. Are we changing focus enough that we need to come up with a new one and get even more confused, or should we just stay where we are?
The reason that I suggested that we consider it is because we have two names, Community Health Improvement Plan, CHIP, and we also have the Community Advisory Council. Didn't want anybody to get confused, so it's the
Yeah, but
CHIP.
isn't the CAC part of it? Isn't that how that works out?
Well,
Because when we go to OHA and they talk about those of us representatives, we are the CAC within the, okay, what is it, program partnership, the partnership?
so from the
Yeah.
CCO standpoint, we are a CAC, Community Advisory Council. But that only really impacts 25% of our population. The other 75% aren't involved in the Eastern Oregon CCO. So each one has a little bit different focus. But if everyone feels fine with calling it the CHIP program, we can still keep doing that.
Should we vote? Okay, is there any other options besides CHIP? Okay,
And I'd say we're gonna stay with the CHIP program.
all right.
Everybody good with that? All right. Do we have any other business that we need to talk about today? Yes, ma'am.
We're having a giveaway at the senior center, it's not food, but.
Money?
No, but clothes. On Saturday from 10 to 2, we're having our first annual free sale. So in the past, we have taken loads and loads and loads of stuff to Klamath Falls, to the Mission, or to Goodwill when we get way too much stuff in the thrift store. And for the month of May, we collected everything, didn't ship it over there, we've been storing it downstairs in the basement, and the piles are growing. We're gonna drag it all upstairs and open the doors and give it away to our community,
That's
Nice.
awesome.
residents of the town. And we're gonna have hot dogs, chips, and drink, you know, kind of lunch thing. And we're having a bicycle raffle, so we were donated a brand new bicycle, and you can buy a ticket for only $1, and we are gonna give away a bike that day, so
This is gonna be when?
this Saturday.
This Saturday. Jimmy, did you get that in the paper already?
I can get you one.
Send us a flyer.
Early last month, but we'll have something in lowdown.
You'll have something to load up?
Yeah.
Awesome.
Let me give you-
That's great
I'll
news.
give you an email address to send it.
Also, on Tuesday, and I'll email it out to everybody, on the CHIP, email, there's next Tuesday, the 14th, from 10 to 12, at the senior center, we're going to be having a community conversation. And we're inviting anybody and everybody that provides services to Lake County. It's being coordinated by Jill Sipes with DHS in Klamath Falls. AAA will be there, for those of you who are aware, with Area Agency on Aging. And we're inviting DHS, we're inviting, she wants to have a Gobi representative, Spokes Unlimited, basically anybody who receives money to provide services to Lake County is who we want to be there. Each group will get a chance to do a short presentation, kind of a general overview, high-level overview of what services they provide, and then we're going to open it up for questions, comments, discussions, everything. The idea is actually came because I started asking too many questions that I didn't know the answers to. There are a lot of services that are available for Lake County that very few people are aware of. One big one is a payee assistance program where that class actually offers in Klamath Falls for those who need assistance in somebody to pay their bills for them, and then here's what you have left over at the end of the month. We have quite a few people that could benefit from that service, and it's been available for a very long time, and we didn't know it.
When is this going to be held?
Tuesday at 10 a.m. at the senior center.
What's the date, Tuesday?
The 14th.
So when you send that out, we also send the flyer
Yeah.
for the event this weekend.
That's awesome. I would just encourage everyone to keep in mind the deadline that Jimmy has for the paper. That is, what day is that, Jimmy?
Monday at noon.
Monday at noon. So if you want to get it in the paper, that's certainly really is well read, and it gets a lot of information out. We can put it on our Facebook page, that kind of thing. That really helps. These are really valuable things for our community to let people know about.
And are you also aware of the fact that the Oregon Community Foundation is providing a free luncheon to talk about the investments and the foundations available in our county also on Tuesday at noon in the chamber? Christina Sands sent us out a letter a week ago, and we member blasted it, but they've only got about 6 people signed up, and it is a professional outreach for that, and it sounds like we need to get some more information out, because they were talking about the 8 foundations that directly are supplied by members of our community here that go back into Lake County, and they're explaining how that works for OCF, and that granting process is really important, so. Good, okay, I'll do that.
That would be great. And I don't know if enough people watch the cable, see the channel 3, is it?
Yeah.
That has, or 4, excuse me, that has that. Well,
It's fun.
I don't have cable TV. I don't.
But a lot of people do, so go ahead.
And that'll be at noon on Tuesday at the chamber. Great.
Free lunch.
Yeah, and they asked for registration because the Lockers is providing a meal, and they want to know about any dietary restrictions that people have.
Marvelous. Do we have any other announcements? These are all really great. If not, thank you very much, everyone, for attending. We really appreciate all of your input, all the great work that's going on in the community. It's really awesome. Thank you. Thank you, Estelle.
I'm in.